Be inspired, supported, and empowered. This is the Global Healthy Living Foundation podcast network.
Welcome to the Health Advocates. I'm Steven Newmark, Chief Policy Officer at the Global Healthy Living Foundation. We're here to tell you what's happening in the world of healthcare to make informed decisions to live your best life. This year, America is celebrating its 250th birthday. When we think about our nation's history, we usually think about wars, presidents, constitutional debates, economic booms and busts, and technological breakthroughs. But today, we're going to tell a different story, the story of America through the lens of health. Because over the last 250 years, the United States has fought countless battles, not just on battlefields, but against epidemics, chronic diseases, infant mortality, unsafe food, contaminated water, smoking, HIV, cancer, COVID-19, and many other threats. Along the way, America built institutions, developed groundbreaking medical discoveries, expanded access to care, and dramatically increased both the length and the quality of our lives. The story isn't perfect. There have been mistakes along the way, there have been disagreements, there have been setbacks, but there has been extraordinary progress. Let's begin before the United States was even born. George Washington almost certainly saved the American Revolution with a public health decision. That's right. As a teenager, Washington traveled to Barbados, where he contracted smallpox. He survived, but many others did not. Smallpox was among the deadliest diseases in human history, killing roughly 1/3 of those infected and often leaving survivors permanently scarred or blind. Years later, during the Revolutionary War, Washington watched as smallpox swept through the Continental Army. Disease killed far more soldiers than British bullets. Washington faced a difficult choice. At the time, there was no vaccine as we know it today. Instead, physicians practiced inoculation, intentionally exposing people to a milder form of smallpox to produce immunity. It carried real risks, but Washington realized that allowing smallpox to spread unchecked posed an even greater threat. In 1777, he ordered the mass inoculation of the Continental Army. Many historians believe that decision preserved the army that ultimately won American independence. One of America's earliest victories depended not just on military strategy, but on public health strategy. Few discoveries have saved more lives than vaccines. The first vaccine against smallpox appeared in the late 1700s. Over the next 2 centuries, vaccines protected generations of Americans against diseases like tetanus, pertussis, measles, mumps, rubella, hepatitis, and many others. Then, of course, came one of the most feared diseases of the 20th century, polio. Every summer, parents feared outbreaks. Swimming pools closed, movie theaters emptied. Children literally became paralyzed. Some spent months or years inside iron lungs because the disease prevented them from breathing. Then, in 1955, Dr. Jonas Salk introduced the first successful polio vaccine. The results transformed public health. Within years, polio cases plummeted. When a reporter asked Dr. Salk who owned the patent, he famously replied, "Well, the people, I would say. There is no patent. Could you patent the sun?" His answer reflected the hope of an entire generation. Vaccines remain one of medicine's greatest achievements, preventing millions of deaths every year around the world. Scientific discoveries alone are not enough. Countries also need institutions capable of protecting public health. That process begins gradually. A small federal laboratory established in the late 19th century eventually grew into the National Institutes of Health. Today, NIH supports research that has helped produce breakthroughs in cancer treatment, heart disease and Alzheimer's disease, autoimmune disorders, rare diseases, genetics, and precision medicine. Many medicines Americans rely on today can trace part of their development to NIH-supported research. Another milestone came after World War II. The Centers for Disease Control and Prevention, the CDC, evolved from a small agency focused on malaria control into America's premier public health agency. For decades, the CDC has tracked disease outbreaks, investigated foodborne illnesses, monitored vaccines, helped eliminate infectious diseases, reduced tobacco use, strengthened emergency preparedness, improved maternal and child health, and provided the surveillance systems that allow us to recognize new health threats quickly. Health also gained a permanent seat in the President's cabinet. The Department of Health, Education, and Welfare was established in 1953. In 1980, it became the Department of Health and Human Services that we know today. HHS currently oversees agencies that influence nearly every aspect of American healthcare, from biomedical research to Medicare, Medicaid, the Food and Drug Administration, and the nation's general public health responses. One of the most significant moments in American health policy arrived in 1965. President Lyndon Johnson signed Medicare and Medicaid into law. Before Medicare, many older Americans struggled to obtain health insurance after retirement. Medicare fundamentally changed that reality. Medicaid provided health care coverage for millions of low-income children, adults, seniors, and people with disabilities. Together, these programs now provide health coverage to well over 100 million Americans and have become central pillars of the nation's healthcare system. America's health system has also been tested by crisis. In 1918, the influenza pandemic killed hundreds of thousands of Americans and millions more worldwide. It revealed the devastating impact infectious diseases could have on entire societies. Beginning in the 1980s, HIV and AIDS challenged medicine, public health, and society itself. At first, doctors had few answers. Patients faced fear, stigma, and limited treatment options. Over time, remarkable scientific advances transformed HIV from what was often a fatal diagnosis into a chronic condition that many people can successfully manage for decades. Public health also confronted threats ranging from Legionnaire's disease and West Nile virus to H1N1 influenza, Ebola, Zika, and opioid overdoses. Each emergency has strengthened our surveillance systems, our preparedness, and our scientific collaboration. Then came COVID-19. The pandemic touched virtually every American family. It strained hospitals, it disrupted our school system, exposed weaknesses in our healthcare system, and it claimed more than 1 million lives here in the United States. Healthcare workers performed extraordinary work under incredibly difficult circumstances. Scientists around the world collaborated at unprecedented speed. Perhaps the most remarkable scientific achievement was the rapid development of mRNA vaccines. Although they seemed to appear almost overnight, the technology rested on decades of research funded by governments, universities, and private industry. Messenger RNA, or mRNA, teaches our own cells to temporarily produce a harmless piece of a virus, allowing the immune system to recognize it and prepare defenses without exposing oneself to the virus itself. The success of those vaccines demonstrated not only the power of modern science, but also the importance of sustained investment in biomedical research. Today, researchers are exploring mRNA technology for flu, RSV, and personalized cancer vaccines, among others. COVID also accelerated telehealth, strengthened laboratory networks, and highlighted both the strengths and challenges of America's public health infrastructure. The Affordable Care Act expanded health insurance coverage to millions of Americans. It prohibited insurers from denying coverage because of pre-existing conditions. It also allowed young adults to remain on their parents' health care plans until age 26. It expanded access to preventive services and strengthened patient protections. Like many landmark laws throughout history, it has generated rigorous political debate. But regardless of where one stands politically, the Affordable Care Act significantly reshaped the American healthcare system. 250 years after George Washington confronted smallpox, America's health challenges continue to evolve. Today we face chronic diseases that account for many deaths. We confront rising healthcare costs. Mental health needs continue to grow. Artificial intelligence promises to transform diagnosis and treatment. Gene therapies are curing diseases once thought incurable. Precision medicine allows treatments to be tailored to individual patients. Researchers continue working toward vaccines and therapies for Alzheimer's disease, cancer, autoimmune conditions, and countless other rare diseases. The next breakthrough may already be taking shape in a laboratory today. As we celebrate our 250th birthday, it's worth remembering that the nation's story is not only written in the Declaration of Independence or in the history books, it's also written in the hospital wards, research laboratories, public health departments, in the lives of millions of patients whose futures changed because someone asked a simple question: how can we do better? Over 2.5 centuries, America has built one of the world's most influential systems of biomedical research, public health, and medical innovation. It hasn't always been easy, it's not always perfect, but generation after generation has pushed medicine forward here in the United States. That is a legacy worth celebrating. Thank you for joining me on this special 250th anniversary episode of The Health Advocates. If this episode helped you understand what's happening in the healthcare world, if you found it interesting, please share it with someone who needs it. And if you have thoughts for us, please leave a comment down below. We'd love to hear from you. To stay informed on all the policy information you need, click the button below that says subscribe. It's totally free to you and lets you stay up to date when new episodes come out each week. I'm Steven Newmark. We'll see you next time.
Be inspired, supported, and empowered. This is the Global Healthy Living Foundation Podcast Network.